women I know learn that they're pregnant, they usually get very excited, and most of them would actually cannot wait for the time when they have their babies in their hands. Probably all of them would visit their obstetrician regularly, some almost every month, never missing a single prenatal checkup. They buy all the vitamins and medicines that are prescribed to them by their doctors, eat the right kind of food, and take care of their health. Particularly, I would like to emphasize that they know that they should avoid smoking and avoid secondhand smoke. When they deliver, of course, the baby will be very healthy. They choose the hospital or any health facility that they want to deliver their baby, and of course, they should be very accessible to their homes. So when they give birth, their babies are usually the pink of health, and their bodies are able to recover very well after the delivery. Not all of the women in the Philippines are lucky, and not all of them have the opportunity.
358,000 women die each year from pregnancy and birth-related issues. 99% of them come from developing countries. Here in the Philippines, 1 in 31 women are at risk of dying due to childbirth and its complications. 11 women die every day giving birth.
The maternal mortality ratio will not improve unless you improve your local health system. That's why the MMR is a good sentinel information. Unless we have drastic interventions to improve the MMR, chances are we will have difficulties meeting the target of 52 by 2015.
In order to help achieve these goals and improve healthcare in the country, the Zuellig Family Foundation launched the Health Change Model. A new development strategy formed in 2008, the Health Change Model is a systematic transformation of local health systems that begins with improving local health leadership and leads to better health outcomes for the poor.
From 2009 to the present, 30 municipalities have completed the program. The improvements in the MMR can be attributed to the fact that the health services were improved, brought about by more responsive municipal health leaders.
This program has so far led to improvements in the welfare of poor Filipinos living in rural areas. As leaders began implementing health policies and programs targeting the needs of their people, health statistics, particularly their maternal health indicators, greatly improved.
Bringing down the maternal mortality ratio is not the role of the government alone. The government needs partners from the private sector and from the civil society to make it happen.
Now, a pillar in the medical industry heeded the call.
MSD, as a healthcare leader who is working to improve and preserve human life, actually brings about a century and a half of experience, scientific innovation and dedication to help the global fight against maternal mortality.
MSD, through its MSD for Mothers program, has committed to work with the Zuellig Family Foundation for 3 years. This joint development initiative aims to help mothers in 21 of the 70 municipalities in the 3 provinces of Samar Island, all of which are part of ZFF's priority regions in the country.
Samar is one of country's geographically isolated and disadvantaged areas. It also has a relatively high maternal mortality rate. What this partnership aims at is helping the country achieve its Millennium Development Goal by reducing maternal mortality. It also supports the Department of Health's vision on universal healthcare and empowers the local government units to achieve health leadership and governance.
MSD will also provide support and assistance to Samar's local health leaders in utilizing government financial and non-financial resources, training for local health workers on antenatal and obstetric care, and accessing education, information dissemination, and social marketing to influence health-seeking behavior at the community level.
The Department of Health continue to provide the services and the programs and the policies for women to have access to these services, particularly when they're pregnant. But the Department of Health cannot do it alone. Even if we have the different programs for the maternal and child care, we still need partners. That's why we welcome these partnerships with other organizations, including non-governmental organizations, because we know that we can do more when we work with them.
I think in the next 3 years, what we want to see in Samar are local chief executives to improve their maternal and child programs such that mothers do not die giving birth. And secondly, that their children don't die at childbirth. And when they survive, they are able to have a healthy childhood.
MSD is committed to finding solutions to the health problems of the developing world by expanding access to its life-saving medicines as well as vaccines. We remain committed to making our vision a reality, a world where no woman dies giving life.